My name is Jamarte Taylor, and I'm a community health intern for the health ministries team at Redeemer Lutheran Church in Northside. Last year, we came up with the idea to have a reverse health affair. We decided to listen to people and get their ideas about health. Thanks to Fairview Foundation, we made that become a reality. We've interviewed 95 people, and what you're about to see is a reflection of what we heard.
I don't know about you, but I don't need a doctor. I need somebody who's going to give me reliable answers about things like why I have chest pains when I'm playing basketball or lifting weights.
Like a team of people who are good listeners, have knowledge about healthcare in general, and help people get healthcare when they need it and answer questions. But they have to be trustworthy too.
Going to the doctor is one thing, but how am I even going to afford seeing a doctor?
I usually make fried chicken and fries are potatoes, so they're vegetables, right? If only there was a farmer's market closer with fresher vegetables.
I need to take long walks and get some exercise, but the farmer's market isn't even open. Besides, how would I even have time for a walk like that?
My husband had lost both of his jobs last year, and we have a son who plays 2 sports. And my thing is when and if he's on the field and he gets injured, it's that trip to the urgent care that I don't see how we can cover.
Yeah, I know, because I worry about my mental health issues, but I don't have any health insurance. So how am I supposed to find a good therapist? I mean, what am I supposed to do?
Think about also what we eat. So with or without health insurance, what we're eating at home and what I'm eating's contributed to the possibilities of hypertension, cancer, my and the blood pressure, the salt. And we know it, and we know there's a legacy and a history of hypertension and issues around blood pressure, and the diet contributes to it, but where are the vegetables? Where is the access to the food that
I understand food well what you're saying, because it really would be nice to have a better diet.
So on days like this, I'd love to go for a jog or go to the Y, use some equipment, but I can't even go to the North Side Y anymore.
Right.
Ever since they changed it, they're only like serving youth, adolescent. I don't even know what's going on, but I know it's 21 and under.
It's cost so much for nutritionists. I mean, where do we even know where to go look for a nutritionist? Do they even have them in this area? Do we have to go further than a hospital, or you have to be linked up to a clinic or something? I don't even know where to look for a nutritionist.
Okay, this winter was a problem for us getting to the church. Not for John, because he could drive and park and get in, Although one Sunday, he said he had a hard time getting over the banks himself.
It's important to have access to good and meaningful information.
You know, I think for some people that don't have the support to live in this community, their needs such as traditionally the church was a center of life, and it was a place that you would come to interact. It was a place that you would come to get questions answered. And there's still people that live in this community. They don't interact with community centers. You know, they don't know how to access health centers. They don't know how to get involved with WISE and that sort of thing. You know, it's more middle class, more sophisticated. There are people that live in this community that their only interaction may be to go to the barber shop or to a club or something. But to see the church as a place that can help you to make the best of your life is something I think is really lacking, you know, in the church.
I haven't too bad a problem, but I do have a loss of hearing. For me, one of the most important parts of church is to be able to hear the sermon and also to hear the gospel and the epistle lessons.
You're better off if we could take half as many pills as we all take.
Yes, yes.
And massage once a week.
Yeah.
To me, that would be the most soothing and helpful thing for my health.
Well, being healthy and being able to exercise is important to both of us.
There must be a balance of reasonably good choices in food, even at older age. Age is part of being staying reasonably healthy is possibly not being too harsh on everything, including people, the world, politics, and so on.
How can we be healthy? Not just you, not just me, but we need to be healthy. Together. Sometimes the weather is to blame. Snow seems to fall day after day. Wishing the snowbanks would melt away. Longing for connection with family and friends, but there's that lonely wintertime trend. So how can we be healthy? Not just you, not just me, but we need to be healthy. Sometimes it seems like you need to be wealthy in order to afford those things that are healthy. Fresh food and lessons to cook them, a gym membership and motivation to use it. I also need help from that great man above and family and friends to show me love. So how can we be healthy? Not just you, not just me, but we need to be